So I'm Dr. Ortega and I'll be performing ear examination to our patient. Good morning, ma'am. Can you state your complete name?
I'm Andrea Ortega.
Okay. So before we start, we should ask the patient, have you felt any recent pain or tenderness in your outer ear?
No.
No, alright, okay. So otoscopic examination, you should first check for the outer ear and also the mastoid process for any signs of otitis externa. If there's none, you can proceed. So shine the light inside your patient's ear, the auricle, upward, backward, away from the head of the patient. Check the ear canal for any signs of redness, cerumen, discharge, etc. For your eardrum, check for the cone of light to orient you. Also check for the malleus, pars flaccida, pars tensa, and others for any signs of perforation or injury to the ear canal. So that's how you examine the patient's ear. So after this side, you check the other side of the patient's ear.
Hello everyone, today I'm going to show you how to do Weber test. To conduct this test, make sure the room is quiet and you have a tuning fork of 256 or 512 frequency. And before you start, make sure you explain to the patient what you are going to do. Let's proceed. Hello, I am Dr. Laisha and I'm going to do Weber test on you. This is used to test for lateralization of your hearing. So what I'm going to do is put this tuning fork into vibration, and then while it's vibrating, I will place this on your head, and then you have to tell me if you can hear the sound of vibration. If you can hear it from your right side more or from your left side. Or you can even tell me if it's hearing equally on the both sides. So I will first put this on vibration. Can you hear the vibrations?
Yes,
From which side you hear it more?
both sides equal.
Thank you. So after the test is done, then you will have to explain to the patient what you got.
Rinne test is used to evaluate hearing loss. It further promotes us to differentiate between air conduction and bone conduction. Let me know when you stop hearing vibration.
Stop.
Stopped. In which position do you hear louder noise? Air. For the air conduction, we place the tuning fork in front of the auricle. To evaluate for the bone conduction, we place the tuning fork on the mastoid process. In a normal patient, the air conduction is always more than bone conduction. For a patient who has hearing loss, bone conduction is more than air conduction.
Hi, this is Kollipara Vineeta sir. Please take your seat.
Thank you.
I am going to conduct Bing test on you. Is it okay with you? In this process, I am going to charge the tuning fork and place it on your mastoid bone, and alternately I will be closing and opening your tragus. Please observe the intensity of the sound when it's closed.
This test is for bone conduction. If patient hears change in loudness when the ear canal is occluded, which is seen in normal ear or sensorineural hearing loss, indicates positive for Bing test. If patient notice no change in loudness when the ear canal is occluded, which is seen in conductive hearing loss, indicates negative for Bing test.
Hello everyone, I am Rajyaguru Rahul. In this video, I will describe Schwabach's test. It is a tuning fork test, so before the description, I will demonstrate how it is done.
Sir,
Yes please, have a seat.
thank you.
Okay, hello, so I am Dr. Rahul Rajyaguru. And what brings you here today?
Hello sir, my name is Preeti Sabharwal and I have some hearing issue since last 2 or 3 months. That's why I am coming here.
Okay, so Miss Preeti, since you have hearing problems since last few months, I am going to conduct a test which is called Schwabach's test, in which I am going to use this tuning fork. I will place this tuning fork behind your ears, and when you stop hearing the sound, just raise your finger, so I will proceed further, okay?
Okay sir.
Okay, so can you turn to that side? Yeah, okay. So, how do we interpret this test? In this test, the patient's bone conduction is compared to the examiner's bone conduction. So, the prerequisite for the test is that the examiner should have normal hearing. Now, neural hearing loss, the patient hears the fork for a shorter duration of time. But if the bone conduction is the same as the examiner's bone conduction, then there is no conduction defect in the patient.
I'm Ansari Faiza. I'm going to perform anterior rhinoscopy. I'll inspect your nose. Have you got any pain or tenderness around your nose? This is nasal speculum. I'm going to use nasal speculum to examine your nasal cavity. We use nasal speculum and we hold like this with the help of index finger. First, I'm going to check any abnormality in the nasal cavity or any mass in the nasal cavity. Then I'll go for the anterior rhinoscopy. This is nasal speculum. I'll introduce in your nasal cavity. Now I'm going to check for the nasal obstruction. This is a tongue depressor. I'll occlude your one nostril like this. And I'll check for the misting of tongue depressor.
I'm going to do a physical examination on you. Is it okay for you?
Yeah, it's okay. You can continue.
Can you just open your mouth? Make your head up, chin up. And this is the tongue depressor, which used to depress the tongue. And this is the mirror, which we are going to see whether there are any adenoids, larynx and nasopharynx. Okay, thank you. And this is the procedure of posterior rhinoscopy.
I'm Ahmed Naufa. Today I'm going to do oral cavity exam on you. Is it okay for you?
Yeah.
First, before doing this, I'm going to use, we need a tongue depressor and a light to better visualize the oral cavity. So first I'm going to start with inspection of the lips. Check for any signs of dehydration. And using the tongue depressor, I'm going to retract the lips and cheeks. Can you open your mouth? Check for any signs. Check for the gum, color of the gum, upper teeth, lower teeth. Tilt your head a little bit up. And check for the color of the oral mucosa. Next, can you protrude your tongue for me? So in this one, we are going to check for the hypoglossal and nasopharyngeal nerve. If there is a deviation in the affected site, there is a hypoglossal nerve palsy. And if the tongue moves to the healthy side, there is a nasopharyngeal nerve palsy. Can you again protrude your tongue for me? This is for the palpation of the tongue. Is it okay for you? So with this, I'm going to palpate, move your tongue to the side, check for any lesions, repeat it to the other side. Open your mouth for me, say ah. And with the tongue depressor, I'm going to put your tongue down and check for the software.
Good morning. Today I'm going to present the physical examination on head and neck lymph nodes. So in the starting, I would like to introduce myself to the patient, ask for their name, explain the procedure and gain consent regarding the procedure. Then we take a brief history regarding the patient. If he's having any symptoms, any pain, and we go for inspection. That is, we look for the signs in a patient if he's cachectic or if he's having bruises or rashes or just see the vital signs. So we use both our hands and we start from the submandibular lymph nodes that is present below the chin. We do it backwards toward the submandibular region. Then we see the tonsils and pharyngeal lymph nodes going upwards towards the preauricular that is present in front of the tragus, and then we look for the postauricular lymph nodes. Then we go downwards towards the cervical lymph nodes, anterior and posterior, that is present on the sternocleidomastoid in the shape of Z. Then we go towards the lower region that is on the supraclavicular lymph nodes that is present above the clavicle, and then we also palpate the lymph nodes and going backwards towards the posterior side at the occipital lymph nodes. Patient who is old never palpate with both hands deeply, as it could evoke a carotid sinus reflex and vasovagal syncope.